My name is Elvin. In 1999, I asked my wife what she would like to have for Christmas. And she thought for a moment and said, "What I'd really like to have is for you to get a colonoscopy." Well, I wasn't too excited about that. I was 62 years old, I was in good health, I had no symptoms, and I had no reason to believe I needed a colonoscopy. I felt invincible. However, I did have a history of colon cancer in my family. Both my mother and one of my brothers died at the age of 75 from that dreaded disease. So my wife got her wish for Christmas, but we also got the shock of our lives. I was diagnosed with colon cancer. When we found out that I had colon cancer, we did not know what stage it was, but we knew that it would be a fight for life or death. So we began to research all the places that we would consider. And we could have gone anywhere in the United States. But we knew about UAB, and we knew about the history of the cancer center all the way back to Lurleen Wallace. And we chose UAB because of its reputation and its facility for fighting cancer. And then we began our search for the best doctor we could find. And that's when we decided upon Dr. Marty Heslin. You see, I was diagnosed with stage 4 colon cancer. That meant it had moved from my colon throughout my liver. And a person who has that diagnosis has only a slim chance for long-time survival. But Dr. Heslin says somebody has to be in that slim chance. And we were determined that I would be one of those who survive. Dr. Heslin said, "Go on and live your life and enjoy life." You see, we didn't know if we had 60 days, 6 months, 6 years, or 6 decades. But whatever we have, we wanted to use it and enjoy it to the best of our ability. My wife spent hours on the internet researching, checking every new procedure, every new medication, every new trial that would apply. And Dr. Heslin was very receptive, very accepting. In fact, he encouraged us to be involved. He said that an educated patient is a better patient and has a better chance of survival. When we were researching for our treatment, at first, the consideration was for regular chemotherapy. But my wife had read about a drug called CPT-11. So she took that suggestion to the panel of doctors at UAB, and they agreed to try that along with the traditional chemotherapy. We had the hepatic artery pump implanted. That's a pump that's implanted in the abdomen, and it sends the chemotherapy directly to the liver so that it doesn't go throughout the body, and the body can tolerate heavier doses because it goes where it's needed. 95% of it goes to the liver. And I was able to continue chemotherapy for a few more weeks directly to the liver as long as my body could tolerate that. Then I had to discontinue any drug whatsoever. So from that point on, I had no treatment as far as receiving any kind of medication. However, I did continue to go back for my CT scans. And the first CT scan showed that the visible tumors were still there as they had been before. The next time, they were a little smaller, and so on, until finally the tumors had all disappeared, but I was cancer-free. And I think every patient needs someone like my wife, a member of the family or a close friend, to do their research for them and to try to find what might be able to be used, because cancer is a complex disease, and there are new trials and new treatments every day being discovered and being utilized. And people need to get involved in their treatment.